You've heard it before. When it comes to your health, feel free to get a second opinion. A Bellevue woman did just that, and she is sure glad she did. In today's Living Well, we introduce you to a young woman who is cancer-free just months after doctors found a tumor the size of a melon in her chest. The scans show just how large it was. The white mass in Kristen Mavity's chest, a tumor.
I didn't know how I couldn't feel something like that growing.
Kristen noticed a problem when she and her husband moved to California, and she felt tired all the time.
When I had trouble breathing, I could feel that I wasn't getting a full breath, but I didn't realize it was because my lung was actually being pressed against.
A doctor in California told Kristen it was allergies, but she trusted her instincts, bringing her here to the Nebraska Medical Center. Doctors here in her home state revealed she had Hodgkin's lymphoma.
Hers was a common symptom from disease in the chest. You can have cough or shortness of breath or chest pain or symptoms that can be confused with allergy.
Dr. Philip Bierman says it's also not unusual for young patients like Kristen to get the disease. And when you're in your 20s, you likely don't suspect cancer, allowing the tumor to grow. But there's good news. As large as this tumor was, look at the scan from just 6 weeks into chemotherapy. The mass was gone. Since Hodgkin's lymphoma responds so well to treatment, the Nebraska Medical Center is taking part in a clinical trial. They track patients, and if chemo is working, they stay on the same treatment plan instead of getting an increased dose.
Try and limit the amount of chemotherapy for people who don't need so much therapy, and on the other hand, identify people who are going to have more aggressive disease that might require more aggressive therapy.
The hope, limit possible long-term damage to other organs, so patients like Kristen can have a bright future. Kristen is continuing her education, a woman who cares about learning and getting the right answer.
Find a second opinion, trust your gut, because you know your body better than anybody on the outside can possibly know it.
You can learn more about that clinical trial by clicking on this story on KMTV.com. We'll be right back.